The incontinence industry is a multi-billion dollar industry, all because people think that it's normal to have incontinence. It's normal to have painful intercourse. It's normal to have a prolapsed uterus. These do not have to be normal. They are common. But according to my guest, it's all because we don't know about and we haven't been taught how to take care of our pelvic floor. This is Wellness by Design. I'm your host, Jane Hogan, the Wellness Engineer, and my guest today is Kim Vopni, the Vagina Coach. And we have a great conversation about the simple things you can do to improve your pelvic floor health. And it doesn't matter how old you are, you can do this anytime. All right. I'm looking forward to sharing this with you. I think you're really going to enjoy it. I'll see you inside the episode. Kim Vopni, welcome to Wellness by Design today. I'm so glad you're here, and I'm really excited. I'm going to be meeting you in person soon. But for now, we're on Zoom. Welcome.
Thank you. I appreciate you having me. And yeah, I'm looking forward to meeting you in person as well.
So I really love your whole message about empowering women and just the message that it's not right that pelvic floor issues and pelvic issues are normalized, and it certainly doesn't have to be normal for women as we age. So you're called the Vagina Coach. I mean, you didn't just say, I'm going to start my career and call myself the Vagina Coach. So how did that begin? What drew you into this area of work?
hmm Yeah, I always joke that it's not when people say, what do you want to be when you grow up? It's definitely not something I had on my list. I wanted to be a dolphin trainer, actually. But so back when I was in sixth grade, I saw a childbirth video and that planted the seed of, I don't ever want to have children. So my whole kind of growing up was, I don't want babies. But I remember also having this bit of fascination and looking at my mom and she was an OR nurse. She was very open about bodies and anatomy with my brother and I. And she told me about her birth experiences. And I witnessed her struggle with back pain, struggle with incontinence, have a hysterectomy, have a tummy that wouldn't flatten no matter what she was doing. She stopped exercising because of her bladder leakage. And so this painted, kind of confirmed that video that I saw and painted this picture of, no, thank you. I don't want anything to do with that. And then when I met my husband, decided I did want to start a family. The year before I was pregnant, I watched my sister-in-law give birth, and she birthed totally different to anything that I have seen in the media. We see everybody on the back, your knees at your ears, somebody's telling you to hold your breath and push. And that's kind of how you have a baby. And so what I witnessed was totally different. And I was very empowered by that. And so through my decision to now I do want to start a family, my midwives had recommended a product to me called the Epino, which was a biofeedback device out of Germany. Epino stands for no episiotomy. And it was a product that would help reduce the likelihood of tearing. And knowing my mom had had episiotomies, and I kind of equated episiotomies with challenges like incontinence and chronic back pain and pelvic pain. So I purchased this. I had a great experience with it. I didn't tear, and so I thought, great, I saved my pelvic floor, but I want other people to know about this. So I started selling this product on the side as a little bit of a side gig. And I did it as a side gig for a couple of years and then used it for my second son as well. Hit the pregnancy with him. And then 2009, I was laid off from my job. So I started this as kind of a full-time thing. And my intention was obviously to increase awareness about pelvic health and this product. I also started to sell other pelvic health products. And then I started to look at the way we recover from pregnancy and birth in North America is we don't even think about recovery. We just are given a high five, we get sent home, and then now we have to look not pregnant as fast as possible and get back to the gym and do all the things. And that was also contributing to many of the challenges that I saw in my clients. So I formed a second business called Bellies Inc. And we were wanting to optimize postpartum recovery and bring in some of the traditional practices that are used elsewhere around the world, and very much a pelvic floor restoration program. Juggled those two businesses for a while, created a certification program for fitness professionals. And all along, this was focused mainly on pregnancy and childbirth. And so I'm a personal trainer. I had also trained as a doula. And so my brand or my people knew me as the fitness doula. And that was great for a number of years until I started then going through my own perimenopause and post-menopause phase. And it was this whole other new aspect of pelvic health. And I said, okay, this isn't just do Kegels in pregnancy and here's how you recover better. We need this education throughout all of our life stages. And so doula wasn't going to resonate quite so much. So I think it was about 2016 or 17. I was speaking at a conference, a group of women entrepreneurs, and all the coaches were some sort of a business coach. And my talk was how optimizing your pelvic floor health can make you a better mompreneur. It was a mompreneur conference. And when I went up on stage, I joked, now you have a vagina coach for your business. And that was kind of like this light bulb where I said, okay, there you go. I'm going to rebrand, and I'm going to use this word that nobody likes to say, but it's part of the reason why we have so much stigma around pelvic floor challenges, because we have to hush the word vagina. And even if we can say the word vagina, it was taboo. Social media wasn't allowed. I remember being interviewed on news stations and they told me I couldn't say the word vagina because it was inappropriate. So I thought I'm going to step into this word and try to take away the hush from it. So that's where the vagina coach came from. And now what I do is really, I have an online membership or program. I've got a couple of books as well that gives people the information about what the pelvic floor is, what some of the more common challenges are, what to do about it, most importantly, because so much is within our power. We can do so much when we have the right information. And so really my overall mission is I want people to have this information much earlier in life, but often it's not until a little bit later, but also I want them to know that it's never too late to step in to your power from a pelvic floor perspective.
Mm. So a lot of people will think that I love all that background, by the way, and how you got to what you're doing and how it's evolved with you and where you are in life as well. But yeah, a lot of people just sort of, oh, a little leak when I laughed, and that's just the way it is now. And I'll go buy some, incontinence panties and for the rest of my life.
Yeah.
And people accept that. And actually, they probably are too embarrassed to talk about it. And so they don't even tell anyone. So
yeah,
all these people are secretly, paying this industry that's making billions of dollars from a problem that people can solve themselves. Women can solve this themselves. And that's why I just love what you do. So where do you start? So you said you talk about educating first, and that's probably what we're going to do here is some education on like why women can be empowered. Why are there alternatives for them?
Yeah. So I hope one of my big, hairy, audacious goals is that this starts to be taught in school. So back in 6th grade, when I was learning about sex education and I saw that childbirth video, when we're teaching about menstrual health and, bodies and sexual education, let's plant the seed of this really important group of muscles called the pelvic floor. So the pelvic floor is a layer, 3 layers of muscles. It's multiple muscles. It's not just one. The attachment points for the group of muscles are the pubic joint at the front. So if you're listening to this, you can even just touch your own bony anatomy, your scaffolding. You find that people call it the pubic bone. It's actually a joint at the front. That's one attachment for the pelvic floor. If you're sitting, or even if you're standing, if you sort of pull the flesh of one of your butt cheeks to sideways and you dig in, you'll feel a bit of a bony point in your bum. Those are your ischial tuberosities. You have one on either side. That's also an attachment point for the pelvic floor. And then at the base of our spine, we have our triangular bone as a sacrum, and then our coccyx or our tailbone at the very tip. That's also an attachment point for the pelvic floor. So it's this sort of diamond shape of this group of muscles. And their roles are pelvic and spinal control and stability. So because of the attachment points at the base of our spine and our pelvis, it plays a role in our core control. It's the foundation of our core. And we've all heard of core exercise, but never has anybody told us anything about the pelvic floor. It also plays a role in our continence. So we have the openings of the urethra, the vagina, and the anus. And the pelvic floor is responsible for controlling those openings and help us make the decision. Does something need to come out? Is it an appropriate time? Can I control when that comes out? Or even from a vagina perspective, allowing something to come in potentially. The pelvic floor also plays a role in our organ support. So we have our bladder, our uterus, our rectum, also the intestines. The pelvic floor plays a role in helping keep them in their proper anatomical position, keep them supported there. The pelvic floor also plays a role in our like it's like a sump pump. So if you think about we have a relationship between the diaphragm, our breathing
Yeah.
muscle, and our pelvic floor. Every time we're breathing, there's this relationship or this movement that's happening that's allowing for things to move through the body. And it also plays a role in our sexual response or lack thereof, you could say. So these are really important jobs that the pelvic floor has, and we've never been provided any education about them. And it's a part of the body we can't see. We can see our external genitalia. We can't see the muscles. We can't see what's happening on the inside. We might have heard the term Kegel exercises, and we may have had an interpretation of that. We have loads of evidence to show that Kegels work, but we also have evidence to show that most people do them incorrectly because we've never been taught and never had anybody evaluate if we're doing a Kegel correctly. So then people think that they don't work. So then they stop doing it and they think, well, I tried that and it doesn't work. And I guess I just need to wear pads for the rest of my life.
Mm-hmm.
And as you said, people are also suffering and embarrassed and feel shame. And sometimes they don't want to talk about it because they feel ashamed by asking their doctor. Sometimes they don't want to embarrass their doctor. So they hold back this information. And women wait on average 6.5 years before actually seeking help. And it's usually they've been suffering and suffering. And finally they get to a point where like, I can't do it anymore. They finally go and get help. And then they're sent down the path of pharmaceuticals or surgery, which I don't want to take away from them being solutions for some people, but it never, in my opinion, should be the first line of defense. So we think about that's what the pelvic floor is. Those are the jobs. When things are not working well, we might experience tailbone pain, painful sex, hip pain, pubic joint pain. We might experience constipation. We might have difficulty with voiding. So we maybe can't, like, it's difficult for us to start the flow of urine. We might not feel like we empty completely. We may leak a little bit of urine with laugh, cough, or sneeze. That would be stress urinary incontinence. We may have really strong urges. A lot of people we call it key in the door syndrome. So when they're excuse me, coming home from work, they put their key in the door and all of a sudden there's alarm bells and they feel like they have to race to the bathroom and they don't make it in time.
Yeah.
Maybe they have frequency where they feel like they're going every 20 minutes or 30 minutes and they feel like they have to know where every bathroom is every time they're out of the house. Pelvic organ prolapse, so that's where the bladder, the uterus, the rectum, sometimes the intestines can start to bulge into or descend into the vagina.
Mm-hmm.
And statistically, incontinence is somewhere between 30 and 40% of people. Prolapse is 50% of women who've given birth, and the majority of women have given birth at some point in their life. Yet nobody talks about prolapse, and people are sidelined by that diagnosis. Hysterectomies, which so many people are offered a hysterectomy because of a pelvic organ prolapse. And doctors will often say, well, you don't need it anymore. You're done having kids, or maybe the person never even had children. And they just are loose, like, let's just take it out. We don't need it anymore. And nothing like we don't honor the need for the uterus and the role that it plays in pelvic health. And then women are facing other pelvic floor challenges after hysterectomy because, again, we haven't been provided the information. I feel like I'm going on and on and on, but that's what the pelvic floor does. Those are the most common symptoms. And it is very, very common. And I want people to know that they're not alone in this. There are so many women suffering with this, and I think suffering needlessly. And then we'll, I'm sure, move into what we can do about it.
Oh, I really love that you shared that wide range of symptoms. And also like just helping people understand they're not alone. And, we're going to talk about some solutions, but that there is something that you can do. Now we're talking about women. And I know that obviously Vagina Coach, you're helping women mostly. But I know I've got men in my audience as well. I just wonder, how do they suffer from can they suffer from pelvic floor issues as well in a different way, obviously, but can they as well?
Absolutely. And so the most common time that men will experience challenges is usually later in life when they start to have prostate issues. So
Mm.
prostatitis or prostatectomy, prostate cancer, that is very closely tied to incontinence. So that's one time, but they may also deal with constipation. They may also deal with tight muscles. They may also deal with pelvic pain. They may have erectile dysfunction. And so those can, it's all still tied to the pelvic floor. They have a pelvic floor just like females do. Their pelvis is narrower. It's a little bit higher. They don't have a vaginal opening. They don't have the hormonal fluctuations. They don't have a menstrual cycle. They don't become pregnant. They don't go through menopause. So we face a lot of other additional risks. Our pelvis is wider. We do have a vaginal opening. We have a vagina. We have a uterus. We have the hormonal fluctuations. Many of us have been pregnant at some point. We will all who reach midlife will go through menopause. So it's much less common in men, but definitely they can absolutely experience pelvic floor challenges. And I get asked all the time by women in my community, is this something that my partner can do? Is this something that will help my husband? And so this year I'm creating some male focused content within the program. So the principles stay the same. The principles of posture and breath and exercise are the same, whether you have male or female anatomy. The cueing and how we activate and relax those muscles is a little bit different.
Mm. Okay, that's really good to know. Okay, I got a little hint there of some of the things that might help. So you just mentioned like breath work and posture and a few other things. So let's move into what some of the solutions are, what people can do to help themselves to strengthen their pelvic floor.
My number one recommendation always is to see a pelvic floor physiotherapist. If you live in Canada, it's a physiotherapist. Many parts of Europe and Australia, it's a physiotherapist. In the United States, it's called physical therapy. So it's the same profession. It's just slightly different nomenclature. Sometimes it's called a women's health physio or physical therapy or physical therapist. So looking for somebody who is trained as a physio or physical therapist who has taken additional training in the pelvic floor and has the license to evaluate and treat beyond the opening of the vagina and possibly via the rectum as well. Mm-hmm. I think this is the most underused women's health resource that we have. And so if there was one thing you take away from this podcast episode, it would be to find a pelvic floor PT, book in, and then make it part of your annual checkup. Just like we go to the dentist once or twice a year for a checkup, even if we don't have any toothache or problems, we just have been conditioned to brush and floss and go see our dentist for a checkup. And I kind of provide the brushing and flossing with the pelvic floor exercise and lifestyle education. And then the pelvic floor PTs are who you see for that checkup. So they can monitor skin changes. They can look at the position of the organs. They can look at how you're managing movement and intra-abdominal pressure. What happens to your muscles? Can they respond to changes of movement or laughing, coughing, sneezing, that type of thing? Mm-hmm. And they can screen for it. They can monitor your ability to do a Kegel. I told you that research shows that most people do them incorrectly. The gold standard to go learn how to do it correctly would be to see a pelvic floor physical therapist. So that would be my number one tip.
I like that.
Yeah.
I didn't even know there was such thing.
Yeah. And it's funny because I've been doing this for 20 years and I didn't know when I started. I had never heard of a pelvic floor PT until I started to have pelvic floor PTs referring their patients to me to buy the Epino. So they had pregnant patients. And I had a question on my e-commerce page, like, how did you hear about us? Because I want to know, how are you finding out about this? And they would say my pelvic floor physical therapist. And I thought, what the heck is that? So then I reached out and started to learn. And as soon as I learned, then I thought, oh my gosh, why are we not told this? Just like the Epino, why is not the whole world using one of these? And also now, why aren't we told about this amazing profession of people that can help us with these challenges? So that's always my number one recommendation. And yeah, see one once a year, even if you have no symptoms, but especially if you do. The next thing in terms of things that we can do on our own at home, one is drink more water. And for people that have incontinence or urgency, or they feel like they go to the bathroom all the time, they're listening to this going, are you crazy?
Yeah.
That sounds exactly. But a lot of people who are leaking urine, a lot of people who have that sensation of needing to go to the bathroom all the time, or who, feel the strong urges, they are often dehydrated. They don't drink water because they think, well, if I don't drink, then I won't leak. If I don't drink, then I won't have the urges. If I don't drink, I won't have to go to the bathroom all the time. Sounds logical, but what happens is the urine becomes much more concentrated as we become dehydrated, and that urine, the concentrated urine, irritates the bladder. So the bladder wants to get it out, and it will send you those urgent, frequent signals to get it out. So drinking more water will help you go less, actually. So
Wow.
drinking more water is really important. And the other reason why that's important is because it will also help you poop. Another reason for symptoms like urgency, frequency is constipation.
Mm-hmm.
When we have, when we don't eliminate, when we have poop stuck inside of us, that
It's going to put pressure on.
and put pressure on the bladder, and we will feel
Yeah.
like we need to go more often. And then when we finally do need a bowel movement, we're often straining to get it out because it's probably dried up because it's been in there longer than what would be considered optimal. And that pushing is like a mini childbirth in a sense. We constant straining to poop is not beneficial for the pelvic floor and can make things worse or lead to things like prolapse. So drinking more water, pooping really well, see your pelvic floor physical therapist. And then once we are reaching our menopause, another big shift that happens is the loss of estrogen. We have estrogen receptors all throughout our body. And when we no longer are producing estrogen, our ovaries are starting to shut down. We have loads of estrogen receptors in our vulvas, vaginas, all around our bladder. And so there's this whole kind of blanket condition called genitourinary syndrome of menopause. And it's a collection of genital symptoms, urinary symptoms, and sexual symptoms under this umbrella term of GSM, genitourinary syndrome of menopause. Used to be called vaginal atrophy, which it's a terrible term. It was also very limiting because there's a lot of other things that happen as a result of this loss of estrogen. And it's also, we have to, like, we can't take away from the fact that there are bone changes, there are muscle mass changes, there is loss of collagen, there's loss of hyaluronic acid, there's posture changes, there's all these other things that are also kind of culminating at this point where we also now have no more estrogen. And the tissues in the vulva and vagina can thin and become very dry, irritated. We have burning, itching, painful sex is very, very common. And this is upwards of 80% of women will experience GSM symptoms. And they are not symptoms like hot flashes that will go away. They don't improve with time. And so if you are approaching or beyond your menopause, I highly recommend vaginal estrogen. And I do have a podcast episode and also an article, a blog article about this that provides research because estrogen, the world think that estrogen gives us cancer. There's a whole misinformation about estrogen. And so there's a lot of people talking about like trying to set the record straight about what the actual truth is with regards to estrogen and in specific vaginal estrogen. So I would speak to a care provider about vaginal estrogen, but I also provide in that article other therapies that can be helpful as well if somebody can't or chooses not to use vaginal estrogen. But that is something else that I consider it essential from menopause onwards for the rest of our life.
Wow. Okay. So we got some simple things in there. But also, kind of more proactive things. You also mentioned breath work, and you were talking about how the diaphragm and the pelvic floor kind of work together. So how important is how we're breathing to our pelvic floor health?
Super, super important. And it is when people start doing the exercises as part of, what I'm preaching, the breath is the first thing that they have to learn. And a lot of people are like, I've been doing it the opposite to this. Can I not just keep breathing the way that I've been breathing? And a lot of time it's the way that we have been breathing. Obviously, we're still alive, like our breath is happening, but what should be happening physiologically in the body, when we take a breath in, the diaphragm kind of flattens. So our ribs expand, the diaphragm flattens. What should happen down below in our core canister is the belly should expand to allow the air to come in. and the pelvic floor should also expand. So there's this, it's a pressure system. And as we inhale, there's an increase in pressure and kind of a downward movement. And we need the belly and the pelvic floor to expand to accommodate that. As we exhale, now we're getting stale air out of the body. The pelvic floor contracts and lifts. The belly naturally draws inwards as a co-contraction, and the diaphragm will move back up. And so this synergy of the diaphragm and the pelvic floor ideally is, just happening without us thinking about it throughout the day. But what can interrupt that synergy could be things like poor posture. So if somebody was guarding because they feel like they're going to leak, or they feel vulnerable because they feel like their organs are starting to descend, they may adopt a clenched, kind of tucked under pelvis, squeezing the inner thighs posture, thinking that I'm going to hold everything in. And that changing the relationship of kind of the alignment of the diaphragm and the pelvic floor can disrupt that synergy. So then we become much more shallow in our breath. The diaphragm can't come down as much because the belly and the pelvic floor are clenching. So we don't get that nice space for air and for movement, I would say. Mm-hmm. So we start to breathe more shallowly. We may lack energy. We feel more tired because we're not getting as much oxygen. We're also impairing the digestive process. So another thing that we need is space for stuff to move around. And part of that, I talked about the sump pump with the relationship of the diaphragm and the pelvic floor, is for digestion. So if we are in that guarding, tucked position, we're now probably going to start to develop some maybe pain in the pelvis, constipation, like painful sex with the muscles that aren't able to relax, incontinence because now the muscles they're tired and overworked. They can't react at the right time with the right amount of force that we need. So it's kind of this culmination of things that happen that disrupt that breath synergy. So coming back to, I always say ABC, alignment, the position of the diaphragm and the pelvis, or our rib cage and our pelvis. Breathing, can we now remind the pelvic floor that it should contract and lift on the exhale and expand on the inhale? And then can we now take that and coordinate it into movement? So people think of Kegels as the only exercise to solve pelvic floor health. And if they have gone to a doctor, they've probably been told to go home and do 3 sets of 10 Kegels 3 times a day. And again, they do them incorrectly, and then they think they don't work. But bringing the breath into a Kegel practice and also bringing Kegels into movement to train the pelvic floor dynamically is essential. It's essential because we most of the time are experiencing symptoms when we are exercising, when we're walking or running or coughing or sneezing, when we're upright against gravity. So if we don't ever train the pelvic floor that way, then how can we expect it to be able to build resilience that way? So breath work is, the alignment comes first, the breath comes next, then we coordinate it. So that's kind of the sequence that how I take people through. And the breath is super, super important.
As you were talking, I was thinking about the audience and a lot of people with chronic pain. One of the things that happens when people have chronic pain is they either hold their breath or they do breathe shallow, and then it becomes like, okay, now that's
chicken and the egg,
the pelvic floor. So it's
Yep.
kind of, it's all tied together. And breath work, I just love teaching breath work. It's just so beneficial on so many levels. And yeah, I've had Jana Danielson on the podcast before too. I know you probably know Jana, and she talked about breath work and how important that is. Now, I know that you do exercises as well, like all your videos that I see that are on Facebook and Instagram and so on. Lots of times you're like rolling on a ball or you're doing some kind of exercises. So how important is that? Obviously, it must be important because you're doing it.
Because I'm doing it.
Yeah, and also, I mean, I guess the other thing is it's very visual, right? Sometimes it's hard to demonstrate breath work in a video because people can't really see what you're doing, even though it's important. But so what kind of exercises are the most helpful?
Mm-hmm. So you've brought up Jana's. She has the cooch ball, and the there's an emphasis that's missing on the need to release. So those people that are guarding Maybe it's not somebody guarding, maybe it's just the way that they stand or the way that they sit throughout the day. There's adaptations constantly happening depending on how we hold our skeleton. And oftentimes it's not necessarily favorable adaptations. So we're developing tightness, and that restriction can impair the breath. It can impair pelvic floor function. It can
Cause pain.
cause pain. Yeah, exactly. Cause pain. So um alignment, breathing, coordination, we've talked about that, but part of what helps us find our optimal alignment is releasing what is holding us in non-optimal alignment, releasing and stretching. Very often people who are in that tucked guarding position have very tight hamstrings and very tight pelvic floor muscles. So using tools like the cooch ball or tennis balls or pool noodles or rolled up towels, I use all sorts of things to help release, like help get the muscles to take a breath, to let go, and that can be very challenging for people that are like, but if I let go, then I'm going to leak, or if I let go, then my uterus is going to fall out, and it won't, but that's the interpretation we have. And it can feel very vulnerable to let things go. But that's so important because a muscle that is shortened and tightened and just gripping is not a strong muscle. Some people think that tight is strong. Tight is weak. And so we need to lengthen and release that tension to improve blood flow, circulation, and also give the muscle back its capacity for power, its full range of motion. So release work is always where we start. So after we kind of get the principles of what the pelvic floor is and whatever, we want to look at these are ways that we can release. And so many people are just their jaws on the floor and their eyes are open thinking, oh my gosh, I had no idea how much tension I had. And they don't realize it until they've actually done something like release using a ball to release some of it. Mm-hmm. So that's a really important piece. And so hamstring, pelvic floor, inner thighs, chest, side body stuff. Those are like a lot of the very common stretches or releases that I would have people do, even foot. So releasing tension in the bottom of our feet, because the footwear that we wear, especially if we have positive heels, that's translating up the chain and usually contributing to that shortening of the posterior legs, like the hamstrings and the calves, and therefore the pelvis. So that's a start. And then we want to move into the work. So the release work is kind of like allowing. We always are, especially if we have symptoms, we think, what do I need to do to fix this? I need to Kegel harder. I need to Kegel more. I need to get Kegel weights. And so we have this, we need to do stuff. And really, sometimes we just need to allow and let things
surrender.
Exactly. Surrender, such a powerful word. Mm-hmm. So releasing tension to allow the muscles to be in the place where they have power. And now we want to take it through its powerful range of motion with cueing and movement. So things like we would start out with something like a pelvic tilt or a bridge. Then we might move into a kneeling, like a tall kneel position. Then we might move into a sit to stand. Then we would move into squats. Then we would move into standing one leg balance. Because the other thing that is important for people to know is and why I'm so bullish on the pelvic floor, when people experience pelvic floor symptoms, they sometimes are told, stop exercising, stop jumping, stop running, stop lifting, or they self-remove themselves from exercise because they think it's going to make things worse. So now, especially post-menopause, when we're now at greater risk of osteoporosis and age-related muscle loss and heart disease, those risks are now even further increased because we're not moving.
Right.
And incontinence and prolapse are independent risk factors for hip fracture and falls. So balance and bone health are so important. And our pelvic floor is the foundation of our core and is helping us with all of those things. So we need to get people balancing and moving in all of the different ways while incorporating the pelvic floor so that it can be trained to respond at the right time with the right amount of force.
It's so interesting, this connection between like tightness and problems, and how the whole, like you mentioned, the foot, like people wouldn't even think that their foot could be connected to problems in the pelvis, but
yeah,
they really are connected. You were making me think, Kim, and I don't know if you deal with this at all. It's kind of the stuff I talk about all the time, is emotions and how for my audience, people with pain, lots of times it's kind of started with behavioral adaptations. Gabor Mate talks about, right? These behavioral adaptations where we create this tightness to protect ourselves.
Mhm.
And so it can manifest as pain, manifest as pelvic floor. I mean, how much do you see a connection between emotions or maybe like childhood trauma and things like that with and stress with pelvic floor issues?
Yeah, it's huge. And so you mentioned stress, which can come from that trauma, can come from pain, it can come from many different sources.
Mm-hmm.
And it, we will, our body interprets stress in many ways as a tensing up. And so it could be tensing in the shoulders, it could be tensing in the jaw, it could be like kind of bearing down almost. It could
Yeah.
be curling up into the fetal, like that safety position.
Mm-hmm.
And unraveling that is what feels so vulnerable for so many people. So, and now I mentioned the power of working with somebody in person, a pelvic floor PT. If trauma is part of your past, now you could argue many of us have, there's so many different
Levels of
types
trauma.
or levels of
Yeah.
trauma. Yes.
Yeah.
You could argue that we all have some. However, if you know that that is one of your main concerns, looking for somebody who does have additional training, who is trauma informed, would be beneficial. Um, but stress and trauma will manifest in many ways, often with this constriction, and
Mm-hmm.
that's ultimately hindering power and blood flow and circulation. And then again, is that vicious cycle. Then when we feel those symptoms, now we feel shame because we have those symptoms because we're not doing enough to unravel them. And so we can kind of get into this. You're nodding your head because I know this
Yeah.
is probably exactly what you see as well. So
Yeah.
working with potentially somebody who helps you with with a therapist, with the mind side of things can be really powerful, as well as the in-person physical component.
Mm-hmm.
Breath work in the form of, I talked about the relationship, but breath work like meditation. There's another breath work practice called hypopressives, can help downregulate the nervous system. Um, Tapping is something, EFT, the emotional
Yeah.
freedom technique, is another thing that I find so helpful for people in that moment of like they just get so they can't see the way out, and they may be heightening their symptoms, and that's a way to help calm in the moment their nervous system,
Yeah.
which over time will, again, we're putting new inputs so that we have new adaptations. A bunch of inputs happen to get us to a point of, like, all the adaptations got us to this point, and now we just need new inputs to get us to another endpoint, if that makes
That's
sense.
that's how I talk too. Like, let's put in a new input to get a different output.
Yeah. Yeah.
Very engineering kind of thing.
Yes.
Um, I love that, Kim. Is there anything that we haven't covered yet that you really want to make sure the audience hears?
I like to leave people with a message that it's never too late. A lot of people, especially who may be on the postmenopause side, hear this information for the first time and they think, well, why didn't anybody tell me? Or it would have been good to know this 25 years ago, or probably won't help me now, or, I have bad knees and now I can't do this. And I want to tell people that change is possible at any stage, at any age. I have a 93-year-old woman in my community who has made changes to her symptoms not knowing anything about pelvic health until she came into this program. So it's absolutely never too late. And the more education you have about your body, the more control we have. I don't know your age, but I grew up in the era of we go to the doctor. Whatever the doctor says, that's what we do.
Oh
And
yeah.
we are always just giving over whatever they tell us, that's what we do. And if they say take this medication, we take this medication. And so I want to shift that to take agency over your health. with the information. So you can make the choice that's best for you, not relying on somebody else who is not you, who is not living in your body, who has not lived your life, making a decision based on a test result or if there's even been that.
I love that message of empowerment. That's so wonderful. And also to know that it's never too late. So for anyone watching or listening, you heard Kim say it. It's never too late.
Yeah.
Kim, what is one thing someone could do today? What would you recommend as like a tiny baby step? Someone like finish this podcast and then just go do it. What would be a tiny step they could take that's going to begin to initiate healing in their body?
There's many to choose from, but I would probably start with a simple thing that I began with at the beginning, which was drink more water. It sounds silly, but if you can increase your water consumption, it will help you poop better. It will help kind of calm those overactivity signals and urgency symptoms. And it makes sure that we're flushing stuff out of our body. We need to stay hydrated, and adding some electrolytes is another way that can really help us poop better and also make sure that we have the energy that we need. And salt is something that we've forever been afraid of, kind of, all these things back from the 70s and 80s that said, fat's bad and salt's bad. Fat's actually really good for us and essential, and salt is too to some extent. So I like some water with electrolytes to make sure that we are really, really, truly getting hydrated. Yeah, so that's one thing that I would say. I recommend 2 to 3 liters of water per day.
I love that. And also, we are mostly water. We need water for this body to operate. So beautiful advice. And I know you're on Instagram and Facebook. Is that the best places for people to find you? And what's your handle?
Yeah, if you go to Google and put Vagina Coach in, you'll find me somewhere. My website is vaginacoach.com, and my social media handles are at Vagina Coach. So whether I hang out mostly on Instagram, I do have a YouTube channel as well, and my podcast is Between Two Lips.
I love it. That's so good. All right. Well, thank you so much for being a guest on Wellness by Design today, Kim Vopni, and tell everyone to go check out the beautiful work that Kim is doing and heed her empowering message. That's what this podcast is all about. And it's a beautiful message that you're sharing. So Kim, thank you for being a guest. Thank you for all the great work that you're doing in the world.
Thanks so much for having me.
All right. We'll see everyone again soon on Wellness by Design.